Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we have Mariella back in here with us. And Mariella is a RN that is practicing traveling nursing in 3 states now, you said, right?
Yes.
California, what?
Ohio and Wisconsin.
Yeah, so you're making the rounds, huh?
Yes,
Literally.
I am.
And what type of nursing are you doing?
So I practiced psychiatric care, inpatient psych in Wisconsin for 6 months, and I have worked critical care and cardiac care nursing. I've been in the nursing profession for 13 years.
That's great. So you have an interesting perspective on the orthodox medical model versus chiropractic care because you've been in both and you've had both.
Absolutely.
And one thing that we were talking about earlier is that, you know, I always do my research on everything going on in the healthcare field. So CDC has reported several years running now that 130 people a day die of opioid overdoses. So that's why we're in the opioid crisis. Chiropractors didn't cause that. That's all due to the pharmaceutical industry and the physicians writing those prescriptions to patients for pain. And we deal with pain naturally through adjusting the biomechanics of the spine, taking the pressure off the nervous system so that your body can function normally on its own. So we're not putting anything into your body, nor are we taking anything out of it surgically either. And I also noticed that Johns Hopkins 3 years ago did a scientific study that showed that medical mistakes were the 3rd leading cause of death in this country.
Absolutely.
And you've had some personal experience with that, seeing that in your arena too, right?
Yes, I have.
Where sometimes medications are dispensed wrongly or above or below the dosages, and people react to those in a terminal way.
Absolutely.
Yeah. So I think the whole point of this is that there are still some, I want to say this nicely, ignorant people out there commenting on our videos that chiropractors are quacks and that, you know, we don't have a medical education and we're not scientific and all that. Well, I'm here to tell you that I went to Palmer College of Chiropractic in Davenport, Iowa, and it's all about science. Science in the art and science and philosophy of chiropractic is orthopedic, neurological issues. There is a spine and a nervous system. You have a brain that's housed inside of the skull that transmits down through the foramen magnum and becomes the spinal cord, goes down through all 24 freely movable vertebrae, and then exits the nerves off of the spinal cord through the intervertebral foramina that supplies every organ, muscle, tissue, and cell in your body. So guess how many people died every day from a chiropractic adjustment in the last 5 years? Zero. There are more deaths every single year due to medical mistakes than there ever has been in the entire history of the chiropractic profession since Daniel David Palmer discovered it in 1895 in Davenport, Iowa, when he adjusted Harvey Lillard for the first time and restored his hearing. So we're all about communication, neurology, and natural healing.
Absolutely.
And from a nurse's perspective, how do you feel about the current state of healthcare in the United States of America?
I'm very biased at the moment because the work of Dr. Johnson has dramatically changed my life. I came into this office 3 days ago with extensive vertebral subluxations, which is basically when a joint does not move correctly. And as he was saying, the brain and the spine have an intense connection. So when your spine is misaligned, it affects all of your senses. Like
Yep.
he said, the hearing and all of this.
Taste, smell.
And currently our healthcare industry lacks chiropractors. There isn't any chiropractors.
Well, in the medical side of it.
Yes,
Yeah.
in the hospitals. I've worked in nursing homes, I have worked in travel nursing, I've worked in hospitals in multiple settings, and there is extensive neuroscientific research because chiropractic care is a neuroscience.
That's right.
That has demonstrated that over and over again that pain is reduced if not completely eradicated, and I am a living, walking, breathing example of that because I came in here in excruciating pain and I have no pain today. My vertebrae are aligned, I feel free, I am free flowing, and I am
You're
happy.
standing up
And
great, your posture's great.
I have not experienced any panic attacks or feelings of sadness and such. Our healthcare system is currently burdened burdened with the excess of what's going on with the opioid crisis. Why? Because everyone of all ages, shapes, and sizes is not attending to their spine as a fundamental. Taking care of your spine should be routine, just as it is to brush your teeth and eat properly. Right now, our system relies on surgery and very invasive, and drugs to relieve pain. But we have lost the fundamental constructs of what taking care of your body is all about: eating healthy food.
Innate intelligence, your body functioning on its own the way it was meant to.
Exercise, which maintains your alignment. But unfortunately for us healthcare providers, as a nurse, I've experienced the effects of the terrible ergonomics of being on a computer, being on your feet for 12 to 16 hours. And I don't regret any of that because I love what I do. We take, all healthcare providers take a Hippocratic oath to serve and to do no harm.
Right.
But in this system, how could you not do harm to yourself when we do not have the resources or the manpower to care for the patients? Most of the population is obese. Most of the population is drug addicted, and I have a lot
and sedentary nowadays too.
And sedentary, and I have a lot of sympathy and empathy for that. When I take care of my psychiatric patients who are bipolar, schizophrenic, I approach them as a person.
Right.
We are all in pain. We all need help. Please take care of your spine. The healthcare industry needs to recognize chiropractic care because there is so much research that I have read, research neuroscience. There's so many things that are being published, and it's ongoing research, and it's validated research, legitimate research studies.
Published in peer-reviewed journals.
Yes.
Yep.
Everyone that is watching, that is in pain at home, I know that some of you have given up and you've lost hope. I am a working nurse, and I've had to do extensive soul searching. Dr. Johnson even recommended Tai Chi, which I've tried. Don't lose hope. I know that it's hard. Even I, as a working professional, as a nurse, I struggled with anxiety and depression because of the pain in my spine. But you do not have to live this way. This is not the way that you are meant to live. Take care of your spine, take care of your health. Because I went to multiple chiropractors seeking to relieve myself. Of course, nothing like what I experienced here, because everybody has their own techniques and approach, and you can see that for yourself in the research. And
just by watching our videos.
And watching the videos. There you go. Nothing has given me the relief, the complete relief that this has. And I didn't have to take a drug. There were no side effects. This has just been healing. And that's what I went into the nursing and medical profession for.
Oh, well, thank you for sharing that. I think that a lot of people don't realize that healthcare in the United States is the most expensive healthcare in the world, yet it ranks among the lowest of all civilized nations as far as outcomes. So, it's actually become a sick care system as opposed to healthcare. And that's what chiropractic is actual healthcare.
Right.
So, before you start making quack comments, get yourself educated on the real science, art, and philosophy of chiropractic care, because it is so much more than what you have been made to believe by the AMA or the TMA or whoever's influenced you to think that chiropractors are quacks. You've seen me treating people from all over the world here this week.
There's a guy from Sweden. He's back today, right in the office.
Yep. And have you heard any of them call me quack, or have I done anything quacky since you've been here?
No. No.
So, we're not quacks. We are doctors of chiropractic. We have a education that is parallel to the medical profession education, science, art, and philosophy of the spine and the nervous system, of how to adjust the spine so that the nervous system can function without any interference, and then your body functions better on its own innately. It's just a natural way to function. So we're not putting anything into the body or taking anything out of the body with surgery or prescribing medication. We are drugless, we are surgeryless, and we are fearless.
Absolutely.
So if you have a healthcare issue that you feel is something that is not being addressed medically by your medical provider, try chiropractic out, because you might be surprised at the results that you see through chiropractic care versus taking all those meds all the time. So we're going to go ahead and show you Mariella's adjustment here this afternoon. Okay. No, let's check your posture here first.
Oh, okay.
Yeah. She's getting ready to fly out, so she's all dolled up this afternoon. Just have you flex your head forward and back. You look very nice, by the way.
Thank you.
Mhm. Thank you for sharing that with people because, you know, there's so many.
So when I first came in here, I could barely put my head back. I had very decreased range of motion in my neck.
Yes. And it hurt too.
And it hurt. And
Yeah.
my muscles, just moving my neck, all of my muscles along my spine were severely tightened.
Look how symmetrical you are now on the x-axis, the y-axis, and the z-axis. You're right down the middle everywhere. That's great. See the equal spacing right now?
Absolutely.
On both sides, your shoulders are exactly level. So we're going to decompress her first. But your head up this way. Oops, excuse me, I'm sorry. Here, slide up just a bit, a little bit more. There you go. You know, so when you see that there's 130 people a day dying of opioid overdoses, and that the medical mistakes is the third leading cause of death in this country, if you're going to call someone a quack, who's the real quacks?
Not Dr. Johnson?
Not me, not Palmer graduates, not any chiropractors really. Okay, deep breath in and let it go. I got you. There you go. That's perfect. You're getting better at that.
Yes.
All right, and you're still kicking.
Still kicking, guys.
Yeah. Okay, I got you. Nope, let me have you tilt left a little. There it is. Now tilt right. That a girl. Good job.
And by the way, those big popping sounds, it's only the movement of air.
Yeah, it's the
Because of fluid in
cavitation
your
of the
joints.
joint into the
That's all.
paraphysiological
It actually
space.
feels amazing. It doesn't.
It's not your
hurt.
bones cracking, that's a nitrous gas bubble that explodes when you open up the paraphysiological space. Alright. We are moving the joints to their maximum range of motion per the integrity of the ligament of those joints, which is exactly what should happen. Because if you have less than normal range of motion, you have restriction and fixation. That's when you start getting subluxations. The subluxation complex involves neuromusculoskeletal. No matter what the TMA tries to say or sue us, the Texas Board of Chiropractic Examiners, and try to keep chiropractors from practicing on neuro issues, you cannot separate nerve from the spine. It's impossible. There we go. All right, and got one more right there. Okay. Legs are exactly even. Is there any pain there at all?
No.
Great. Okay. There. No, let me get your neck here for you. That a girl. The other thing that a lot of people don't understand is if your spine's not lined up properly, you're just not going to feel good at all. You're not going to function properly, so you back down. The nervous system gets interfered with, and whatever's at the end of that nerve's not going to function properly. A lot of people have numbness and tingling in their arms and hands and fingers. They get headaches, digestive problems. Upside down just a little bit. So we as chiropractors do not treat disease itself. We are treating the neuromusculoskeletal system of the human body and the vertebral subluxation complex. Chiropractic has been the same for over 124 years. This will be the 125th year of chiropractic's existence next year. But we have done the same thing from the very beginning, which is to detect and then correct vertebral subluxations. And we've never varied from that one little bit. And that's what we're still doing today. Nope, got one more here. There it is. We got a little crepitus on this left one this afternoon.
Mm-hmm.
No, let me do it. You're trying to help me. Let go. There you go. Okay.
That was a good one.
Yes, ma'am. We're starting to get movement in that right wrist a little bit better.
That's my right wrist that I use on the computer all day long. It was in bad shape when I got here, but thanks to Dr. Johnson, this amazing chiropractor, it is better.
Thank you so much. Okay, let's stand over here and I'm gonna teach you my machine gun. Okay, let's have you close your eyes and flex your head forward and backwards for me. And then neutral. Alright, right there. And yes, ma'am. Okay, relax that. Try that again, see if this feels even smoother.
Completely.
It's on a swivel.
Yep.
Look at
on
you.
day 3, I'm
Yeah.
like, I can move.
Yeah, this is your 6th and final adjustment here this week. So how would you share with our YouTube audience around the world what was your experience here?
It was life-changing. I can go back to my field, to my profession, and I can serve others the way that it should be, without pain, without tension. I'm treating patients with pain, opioid crisis, as you mentioned, and then you yourself as the provider, you're in pain. It's just pain everywhere. It's depressing. So now I can go and I can be a light in a world where it's needed now more than ever. Please make chiropractic care a part of your primary prevention.
Thank you so much, Marianne. Thank you for being here this week. I really appreciate you having the confidence and faith in us to fly all the way down here and do this.
Thank you.
And I hope it's been worth your time and money.
Yes, it has been.
Great.
Priceless.
That's wonderful. Thank you very much. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, where we practice pure chiropractic adjustments every single day, Monday through Wednesday. We'll see y'all soon.
Bye.